Imagine cutting out all your favorite supposedly healthy foods,
Yeah.
like spinach, sweet potatoes, almonds.
Right, the exact things we're always told to eat more of.
Exactly, because you were told they were the hidden culprits behind your severe skin flare-ups.
Yeah.
So you follow a super restrictive diet meticulously, right?
Yeah, which is exhausting.
It is, only to find out later that you might have blamed the wrong chemical compound entirely. And your strict regimen was kind of just alleviating your symptoms almost by accident.
It happens so much more often than you'd think.
So today, we are breaking down the incredibly confusing, honestly contradictory science of nutrition's role in a very specific condition. Welcome to today's deep dive. We are exploring a highly requested question, which is, what dietary changes actually help manage lichen sclerosus?
And it is a question that requires navigating a lot of noise because, when you're dealing with a chronic condition, you naturally want to leverage every tool available.
Oh, 100%. You just want relief.
Right. But the internet is just full of these definitive claims that the clinical literature simply does not support, at least not in a broad sense.
So to cut through that noise today, we are looking at a really diverse stack of sources. We've got a recent scoping review from the Journal of Integrative Dermatology, some clinical guidelines from European dermatology associations, and then alongside that, practical insights from specialized vulvar care clinics and patient support networks.
Which is such a vital combination because if you
Ah,
rely solely on high-level clinical trials, you kind of obscure the nuanced day-to-day reality of living with the condition.
right, it gets too clinical.
Exactly. But then on the flip side, relying solely on patient anecdotes can lead us down some pretty unscientific rabbit holes.
Yeah, which we definitely want to avoid.
Yeah.
For those newer to this specific terminology, we should probably set a baseline first. Lichen sclerosus, or LS, is a chronic inflammatory skin condition.
Yes.
It primarily affects the intergenital area, resulting in skin that becomes exceptionally thin, white, intensely itchy, and really prone to tearing.
Which is incredibly painful and disruptive.
Yeah. And we want to establish a hard boundary before we even really get into the food part. The absolute gold standard for treating LS and preventing permanent architectural changes to the skin remains ultra-potent topical corticosteroids, like clobetasol. Diet does not replace your prescription.
That boundary is essential. We have to look at nutrition strictly as an adjunct therapy.
Right.
It's a supporting player that modifies your internal environment rather than, frontline medical treatment.
I always think about the immune system as like a sort of cellular threat radar. So if topical steroids are the localized fire extinguisher putting out the immediate flames on your skin,
That's a great way to put it.
yeah, then can your diet act as a way to clear out the dry brush? So the fire just has a harder time starting in the first place.
The sources strongly support that framing because there is no proven universal dietary cure for LS.
Right. No magic bullet.
Exactly. However, the data really highlights that autoimmune dysfunction and chronic inflammation are heavily implicated here. So modulating that internal radar through food, that's an empowering strategy for patients trying to manage their baseline inflammation alongside those standard medical treatments.
Well, let's look at the numbers behind that autoimmune connection, because they're kind of staggering. The literature notes that up to 82% of LS patients have at least one other autoimmune condition.
Wow. Yeah, that's huge.
Right. That statistic points an enormous neon sign directly at systemic inflammation.
It really does. It suggests we can't just look at the localized skin tissue in a vacuum. We really have to address the overarching metabolic environment.
And when we talk about overarching metabolic environments, I mean, the most universal driver of inflammation in modern society is the standard American diet,
Oh, without a doubt.
specifically the massive influx of refined sugars. And, we hear sugar causes inflammation all the time, right? Like, it's almost a cliche at this point.
It is, but the sources actually detailed the biological mechanics of this, which is fascinating.
Yeah, break that down for us.
So, consuming a diet that's high in refined carbohydrates and low in omega-3s fundamentally shifts the behavior of the innate immune system.
Okay, the innate system, that's the more primitive one, right?
Exactly. It's our body's primitive, non-specific defense mechanism. Unlike the adaptive immune system, which targets specific viruses or whatever, the innate system is basically a blunt instrument.
It just smashes everything.
Kind of, yeah. When you consume high amounts of refined sugar, it causes these rapid spikes in blood glucose. And over time, that sustained hyperglycemia leads to the creation of what are called advanced glycation end products, or AGs.
AGCs.
Okay.
And what do they do?
These compounds literally bind to receptors on your immune cells, and they just constantly trigger that blunt instrument alarm bell.
So the sugar is effectively keeping the body in a state of chronic, low-grade hypervigilance.
Precisely. Which the literature directly associates with the pathogenesis of conditions like lichen sclerosus and lichen planus. The immune cells are primed, they're looking for a fight, and unfortunately, they often end up attacking healthy tissue.
Which leads to the immediate, really practical question of, well, how restrictive do you need to be? Because, fruits and vegetables also contain natural sugars. Does someone need to cut out all carbs to see a benefit? Or is this really just about processed stuff?
And the nuance here is all about the packaging of the carbohydrates. Fruits and vegetables contain natural sugars, sure, but they also contain dense, fibrous matrices.
The fiber.
Exactly. That fiber mechanically slows down the digestion and absorption of the sugar in your gut, so it completely prevents that massive glucose spike, which means you don't get the subsequent formation of those inflammatory AGEs.
Oh, I see. So the problem isn't the carbohydrate molecule itself. It's the fact that refined grains, sodas, candies, they've been stripped of that natural fiber packaging.
Right, which allows the sugar to hit the bloodstream like a shock wave. So the very first intervention is removing those refined, stripped carbohydrates.
But the sources don't just focus on restriction, which I love. They highlight specific compounds you can add to actively downregulate that hypervigilant immune response.
Yes. The Mediterranean-style anti-inflammatory diet is heavily championed in the clinical guidelines.
What does that look like in practice?
It involves introducing high levels of omega-3 fatty acids from oily fish like salmon, mackerel, sardines, alongside complex polyphenols from colorful plants.
And those actually fight the inflammation.
Yeah, these compounds actively neutralize the inflammatory byproducts that are created by a hyperactive immune system.
Okay, the standout example in the literature that blew my mind involves extra virgin olive oil.
Oh, the oleocanthal.
Yes. Because if you were experiencing joint pain, you might instinctively reach for an ibuprofen, right? But the clinical data shows that a specific compound in olive oil called oleocanthal actively mirrors that exact same pharmaceutical mechanism.
Wait, really? It works like an actual painkiller.
I mean, it's a remarkable piece of biochemistry. Ibuprofen works by inhibiting specific inflammatory enzymes in the body, known as KOX1 and KOX2.
Okay.
Oleocanthal, which you ingest simply by consuming high-quality olive oil, acts as a natural, non-steroidal anti-inflammatory agent by blocking those exact same COX enzymes at a cellular level.
That is wild. So food is essentially providing chemical instructions to your immune system.
Exactly. So establishing that baseline of systemic inflammation is crucial. But when you dive into the LS patient communities online, the focus often narrows dramatically.
Yeah, they go from general inflammation to highly specific plant defenses.
Right. We see these fierce debates over a compound called oxalate.
The oxalate discussion is incredibly complex, and honestly, it represents one of the most significant points of confusion for newly diagnosed patients.
What are they exactly?
Oxalates are naturally occurring defense chemicals found in a lot of nutritionally dense plants. We're talking spinach, sweet potatoes, beets, nuts, and chocolate.
And the mechanical issue within the human body is that oxalates are highly reactive. They love to bind to minerals, most notably calcium.
Right, which forms calcium oxalate crystals.
Which are infamous for causing kidney stones. But they've also been theorized to cause microcrystal irritation in really delicate tissues, right?
That's the theory. And the clinical history here is fascinating. Back in 1997, a prominent study looked at vulvodynia, which is a related vulvar pain condition.
Okay.
The researchers placed participants on a low oxalate diet combined with calcium citrate supplements. The idea being that the extra calcium would bind to the oxalates in the gut before they could be absorbed into the bloodstream.
How clever. Did it work?
Well, in that study, 24% of participants reported a positive improvement in their symptoms.
But the more recent data completely fractures that narrative, right?
It really does. A comprehensive 2008 study and then that 2021 scoping review from the Journal of Integrative Dermatology we're referencing today, they found absolutely no clear, broad association between dietary oxalates and LS risk or symptom improvement.
No.
The high-level science suggests the oxalate theory is essentially a dead end.
But wait, if the science says there's no clear association, why are so many people in online forums Swearing by a low oxalate diet. I mean, are they just making it up? Is it a massive placebo effect?
We really have to acknowledge that vast number of patients. Dismissing that volume of anecdotal evidence purely as a placebo effect ignores a very real biological mechanism.
Okay, so what's happening?
We are likely looking at a massive case of mistaken identity.
Mistaken identity.
Yeah. This is where the chemistry gets deeply intertwined. Many of the exact same foods that are notorious for high oxalate levels also happen to be incredibly high in histamines,
Oh, wow.
or they act as histamine liberators in the body.
Okay, so we usually associate histamine with seasonal allergies, right?
Yeah.
Like you get the sniffles, you take an over-the-counter antihistamine.
Right, but histamines are heavily present in our diet too. They accumulate in aged cheeses, red wine, fermented foods, and even leftover meats as the proteins break down over time.
So the problem arises when an individual has a deficiency in the enzyme responsible for breaking down that dietary histamine in the gut.
Exactly, the DAO enzyme, diamine oxidase.
Right, so when you lack enough of this enzyme, your histamine bucket essentially begins to overflow, and that leads to systemic inflammation and intense itching.
And this connects directly back to lichen sclerosus through mast cells.
Mast cells.
Mast cells are the specific immune cells responsible for storing and releasing histamine. And the dermatological literature notes functional differences, basically hyperreactivity, in the mast cells of patients with related skin conditions like lichen planus.
Ah, I see. So a patient might cut out spinach, tomatoes, and certain nuts and experience a dramatic reduction in their intense vulvar itching. And they mistakenly attribute the success to lowering their oxalates.
Bingo. In reality, they were alleviating a histamine breakdown problem. They lowered the level in their overflowing histamine bucket just enough to stop the mast cells from triggering a flare-up in their skin tissue.
So they successfully solved the problem, but they indicted the wrong chemical compound.
Exactly. Which really underscores why attempting to navigate dietary triggers based on internet forums can lead to unnecessary severe food restrictions.
Yeah, that is so dangerous. But before we pivot away from oxalates entirely, the sources actually provide a very pragmatic tip for those who want to continue eating these nutrient-dense vegetables, but, just wish to minimize any potential irritants.
Yes, the boiling trick.
Right. Boiling high oxalate vegetables significantly reduces their oxalate content compared to steaming or roasting them.
Because the oxalates are water-soluble?
Yeah, they just leach out into the boiling water, which you simply drain away, preserving the core nutritional benefits of the plant. Such an easy fix.
It really is. And, we've seen how plants utilize these hidden chemical defenses like oxalates and histamines, but plant-based foods aren't the only ones triggering these inflammatory alarm bells.
Oh, definitely not. The clinical data points to some incredibly localized reactions to everyday animal proteins.
Tell me about the pork finding, because that was surprising.
Yeah. So the scoping review highlighted a retrospective cohort study containing a very unexpected, highly specific statistic. 26% of symptomatic LS patients reported a distinct, undeniable worsening of their symptoms after consuming pork and pork derivatives.
So like sausage, ham, bacon.
Exactly. And a quarter of a patient population pointing at one specific meat. I mean, that is a signal you cannot easily ignore.
No, you can't. And while the precise biological mechanism wasn't definitively isolated in that particular study, we can look at the surrounding biochemical pathways.
What's going on with pork?
Pork contains distinct fat profiles, specifically really high levels of arachidonic acid.
Arachidonic acid?
Yeah. In the body, arachidonic acid is a direct precursor to inflammatory prostaglandins, which are compounds that actively mediate inflammation and pain signaling.
So it's basically fueling the fire.
Exactly. Furthermore, processed pork derivatives are heavily laden with nitrates and preservatives that can independently trigger immune responses in sensitive individuals.
Wow. And alongside the pork data, the sources also detail the clinical perspectives on dairy and gluten, which, they're frequently targeted in functional medicine as primary culprits for autoimmune conditions.
Right. The focus there is usually on casein, which is the primary protein in cow's milk, and gluten, the structural protein in wheat.
And why are those two always the bad guys?
Well, both casein and gluten are complex, difficult to digest proteins. They can trigger low-grade immune responses and increase intestinal permeability, which you often hear referred to as leaky gut.
Right, leaky gut.
Yeah, and that happens in individuals with specific genetic predispositions.
But the literature actually provides a fascinating case study demonstrating just how hyperlocalized these autoimmune reactions can be.
Oh, the pediatric study.
Yes, Researchers documented 3 pediatric cases where children suffered from both celiac disease, which is a severe systemic autoimmune reaction to gluten, and lichen sclerosus simultaneously.
Right, so the logical assumption is that addressing the severe systemic trigger, the gluten, would calm the entire body down.
Exactly. The children were placed on strict, medically supervised gluten-free diets. And while this completely resolved their gastrointestinal celiac symptoms and healed their gut lining,
It didn't touch the LS.
it had absolutely no effect on their lichen sclerosus lesions.
That is just a stunning display of bio-individuality.
Isn't it? A trigger that causes your immune system to attack your small intestine might be completely irrelevant to the immune cells attacking your skin.
It definitively proves there is no magical one-size-fits-all LS diet waiting to be discovered.
So true. But given that pork, dairy, and gluten all fall into the category of potential triggers depending on the individual, patients often ask, what does actually have proven clinical backing?
Like, for improving the skin tissue itself.
Yeah, what's actually working?
Well, the most compelling data in the scoping review focuses on avocado and soybean extracts, frequently abbreviated as ASE.
Basic.
In a prospective cohort study, patients were given an oral supplement containing ASE, vitamin E, and para-aminobenzoic acid, and this was utilized alongside a topical ASE product.
And what were the results?
They were really significant. 70.5% of patients with mild to moderate vulvar LS saw measurable clinical improvement.
Over 70%.
Yeah.
That's huge. How does it work?
The mechanism behind ASE is grounded in cellular repair. These specific plant sterols actively inhibit the production of interleukins, which are signaling proteins that promote inflammation while simultaneously stimulating the synthesis of collagen.
Oh, wow. Because LS causes the skin to thin and lose its structural integrity, right?
Right. So ASE appears to actively promote the tissue repair processes that counteract that exact degeneration.
That is amazing. And the sources also heavily emphasize vitamin D supplementation, right? Moving beyond its traditional role in just like bone health.
Yes. Vitamin D actually functions more like an endocrine hormone than a simple vitamin. It binds directly to receptors on immune cells, actively regulating their behavior and preventing them from becoming hyperreactive.
And deficiency is just rampant across almost all autoimmune populations.
It really is. Furthermore, the clinical guidelines stress the importance of probiotics, diving into the mechanics of the gut-skin axis.
The gut-skin axis.
Yeah. The microbiome in your digestive tract ferments dietary fiber into short-chain fatty acids. These fatty acids travel through the bloodstream and act as potent anti-inflammatory signals for distant organs, including the skin.
So a dysregulated gut microbiome often manifests as chronic skin inflammation.
Exactly.
We have covered an immense biochemical landscape today. I mean, AGEs from sugar, the histamine versus oxalate mix-up, arachidonic acid in pork, the localized nature of gluten reactions.
That's a lot.
It is. For anyone listening, the sheer volume of variables is probably super overwhelming right now. If genetic predispositions and microbiome compositions make us all entirely unique, how do you systematically uncover your specific biological blueprint?
Well, the standard medical recommendation is not to guess, and certainly not to restrict everything at once, which just leads to malnutrition and intense psychological stress.
Right, don't just stop eating.
Please don't. The gold standard is a structured elimination diet.
Okay, so it requires treating yourself as a clinical trial of one.
Yes. The methodology involves completely removing a specific suspected trigger, such as high histamine foods or dairy, for a strict period of 4 to 6 weeks.
And that time frame is non-negotiable, right?
It really is, because the immune system takes weeks to lower its antibody production and actually calm down. During this phase, meticulous journaling of symptom severity, itch frequency, and sleep quality is required.
And then comes the scary part.
The reintroduction. You consume the suspected food and monitor the body's reaction. It provides clear, undeniable data on whether that compound is a trigger for your specific immune profile.
And the sources also outline broader frameworks for those needing a more comprehensive reset, notably the autoimmune protocol, or AIP.
Yes, AIP.
I always think of AIP in terms of troubleshooting a crashing computer by rebooting it in safe mode.
Oh, I like that.
Yet when the operating system is glitching, you boot it up running only the absolute essential core programs to see if the hardware stabilizes.
And AIP serves as that biological safe mode. It strips the diet down to its most basic non-inflammatory components. You strictly eliminate all grains, dairy, eggs, nightshade vegetables, coffee, and alcohol.
Ouch. But you hold that safe mode until the systemic inflammation drops and the gut lining begins to heal.
Right.
And once the system is running smoothly, you slowly reinstall the programs. You re-enter the removed food groups one by one, watching to see exactly which software update causes the immune system to glitch and flare up again.
Exactly. It is a temporary diagnostic tool, not a forever lifestyle.
The sources also dedicate significant space to the ketogenic diet, which, we hear about keto constantly in the context of weight loss.
Oh, everywhere.
But the literature evaluates it purely as a therapeutic tool for chronic inflammation.
Which might seem kind of counterintuitive given the high dietary fat content, right? Like, how exactly does eating massive amounts of fat calm an overactive immune system? It comes down to fundamentally changing the body's metabolic engine.
Okay.
The ketogenic diet restricts carbohydrates so severely that the body can no longer rely on glucose for energy. It shifts into a metabolic state called ketosis, where it utilizes ketone bodies produced by the liver from stored fat.
Right, ketosis.
But here's the crazy part. The primary ketone body, beta-hydroxybutyrate, is not just a fuel source, it is a signaling molecule.
Wait, really?
Yes, research demonstrates that beta-hydroxybutyrate directly inhibits a multi-protein complex called the NLRP3 inflammasome.
The inflammasome. That sounds bad.
It is. By inhibiting it, you are effectively shutting down a major pathway the body uses to generate systemic inflammation.
Wow. So you are literally shifting the chemical signals your metabolism is sending to your immune cells.
Yeah,
The power at the end of our forks is just staggering.
it really is.
So to synthesize the vast amount of data we've covered today, there is no known dietary cure for lichen sclerosus, and preventing permanent architectural tissue damage still relies on ultra-potent topical steroids.
However, manipulating your diet is arguably the most powerful adjunct tool you possess. Whether it's managing the innate immune system's radar by reducing refined sugars, testing a low histamine approach, avoiding the inflammatory pathways of pork, or executing a structured elimination diet to decode your personal triggers.
This entire process is about stepping into an active investigative role. You are no longer just a passive recipient of medical treatments, right? You are the CEO of your own metabolic health, ideally partnering with your physician to optimize your internal environment.
Absolutely. Nutrition in the context of chronic disease shouldn't be viewed through the lens of punishment or restrictive deprivation. It is really a mechanism of profound self-empowerment.
Well said. Thank you for joining us on this deep dive into the dietary mechanics of lichen sclerosus. But we're going to leave you with a final thought to consider, one that points to variables entirely outside our own kitchens. We've discussed the hidden chemical defenses of plants, the oxalates and the histamines that our bodies are reacting to. But we have to ask, as modern industrial agriculture rapidly depletes our soil quality, alters the microbiome of the earth itself, and relies on intensive chemical interventions to force crop yields, are these plants producing the exact same levels of defense chemicals they were a century ago?
That's a great question.
When our immune systems sound the alarm after a meal, are we actually reacting to the natural food, or are we reacting to the invisible ways we've fundamentally altered the food before it ever reached the plate? Something to think about. Until next time, keep digging deeper.